Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia, and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Hi, I'm Dr. Catherine Moffat. I'm a physician specializing in pediatric infectious diseases at West Virginia University. My patients and their caregivers sometimes ask me if children and adolescents can have side effects from COVID-19 vaccination. There can be side effects, although not everyone has them. The side effects that children 12 and up can experience are similar to those in adults. These tend to be mild to moderate and include soreness, redness, and swelling around the injection site, tiredness, headache, chills, fever, or nausea. These effects usually last only a few days, and kids may experience some or none of them. These side effects can be a sign that the immune system is building up its natural defenses against COVID-19, but many people build protection without these signs. Similar to adults, these effects are more common after the second dose, yet that second dose is essential for maximum protection. Although these side effects can occur, they are short-lived and outweighed by the benefits of being protected through vaccination. Many cases of COVID-19 among children and teens are mild, but even mild cases in children can lead to long-term health problems. I've cared for children with COVID-19. Some of their cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And COVID-19 hospitalization rates among teens increased in the spring of 2021. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the person who's vaccinated, but those around them as well, especially children who cannot yet get vaccinated. This is why I recommend that my patients ages 12 and older get vaccinated, and I encourage patients, parents, and caregivers to discuss COVID-19 vaccination with a healthcare provider. Thanks for tuning in. I'm Dr. Catherine Moffat. For more information about COVID-19 vaccines, or to find a location near you, visit vaccinate.wv.gov.
Back to school is almost here. Has your family been vaccinated for COVID-19? West Virginians 12 and older can get vaccinated, and it's the best protection from COVID-19. Protect yourself and your family by getting vaccinated today.
I'm Dr. Jenny Yost, a physician and women's health specialist in West Virginia. I have experience providing gynecologic care to adolescents and young women for over a decade. Are COVID-19 vaccines safe for people who want to have a baby soon or in the future? The answer is yes. COVID-19 vaccines are safe for people who are pregnant, as well as those who may want to become pregnant anytime in the future. There is no evidence that any vaccine, including COVID-19 vaccines, affects people's ability to get pregnant. In fact, leading women's health associations agree that COVID-19 vaccines do not impact fertility. When you get a COVID-19 vaccine, the process of building immunity occurs in the immune system and does not impact the reproductive system. The COVID-19 vaccines have undergone very rigorous safety monitoring. There is no reason to believe that the COVID-19 vaccines will have any impact on the ability to have a baby in the future. So yes, the vaccine is safe for individuals who want to become pregnant in the future. These are just a few reasons why I recommend COVID-19 vaccination to my patients. People who are pregnant or want to get pregnant in the future can choose to get vaccinated. Thanks for tuning in. I'm Dr. Jenny Yost. For more information about COVID-19 vaccines or to find a vaccination location near you, visit vaccinate.wv.gov.
I'm Dr. Kara Willenberg, a physician and chief of infectious diseases at Marshall Health. You might be wondering, how do COVID mRNA vaccines such as the Pfizer and Moderna vaccines work? First, let's start with the ingredients. The mRNA vaccines are made of sugars, salts, lipids, and mRNA. The mRNA, or messenger RNA, tells our body how to make proteins. The COVID-19 mRNA vaccines teach our cells how to make copies of a spike protein that resembles the spike on the outside of the virus. Once our bodies create that spike protein, our immune systems are able to make antibodies. Antibodies can then recognize the virus if we come into contact with it and fight it off. The mRNA from the vaccine does not enter our cells where DNA is made, so it cannot affect our DNA. The mRNA breaks down and goes away quickly, leaving in its place the blueprint for protection. The COVID-19 vaccines boost our natural defenses against the virus. It takes our bodies about 2 weeks after the second dose of the mRNA vaccine to develop maximum protection. You cannot get COVID-19 from the vaccination. By choosing to get vaccinated, you are teaching your body how to defend itself from COVID-19. Vaccination is the safest path toward building a community of immunity. Thanks for tuning in. I'm Dr. Kara Willenberg, and I recommend COVID-19 vaccination to my patients, my family, and my friends. For more information about COVID-19 vaccines or to find a vaccination location near you, visit vaccinate.wv.gov.
Hi, I'm Dr. Gilbert Goliath. I'm a pediatrician in Charleston, West Virginia. I've been practicing medicine for over 30 years. The parents and caregivers of my patients often ask if children and adolescents should get vaccinated against COVID-19. My answer is yes. As of June 2021, COVID-19 vaccines are available for individuals 12 years and older, and I recommend COVID-19 vaccination to my patients who are able to receive it. As a pediatrician, I've seen cases of COVID-19 among my patients. Although many cases of COVID-19 among children are mild, some cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And as we learn more about COVID-19, we're finding that even mild cases in children can lead to long-term health problems. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the vaccinated individual, but those around them as well, especially children under 12 who cannot get the vaccine yet. I recommend that my patients aged 12 and older get vaccinated, and I suggest that all parents and guardians discuss COVID-19 vaccination with a healthcare provider. Thank you for tuning in. I'm grateful for your time in discussing this important matter. For more information about COVID-19 vaccines or to find a vaccination location near you, visit vaccinate.wv.gov.
Hi, I'm Anitra Ellis, a nurse practitioner in West Virginia. I've had the pleasure of serving Southern West Virginia in healthcare for the past 10 years. Patients sometimes ask me if they should get the COVID-19 vaccine if they've already had COVID-19. My answer is yes, you should get the vaccine, even if you've already had COVID-19 and recovered. Although people develop some amount of immunity from getting infected with the virus that causes COVID-19, it is not known how long you will be protected from getting sick again. Even if you have already recovered from COVID-19, it is possible that you could be infected with the virus or one of its variants again. COVID-19 can cause severe illness or death, and we can't predict who will have mild or severe cases. Some people continue to have long-term health issues from COVID-19, even with mild cases. You can also spread the virus to others, including your family, even if you don't have symptoms. Vaccination is the safest path toward building a community of immunity, even if you've already had COVID-19. Thanks for tuning in. I'm Anitra Ellis, and I recommend the COVID-19 vaccination to my patients, family, and friends. For more information about COVID-19 vaccines or to find a vaccination location near you, visit vaccinate.wv.gov.
Hi, I'm Dr. Allison Lastinger. I am a physician specializing in infectious diseases and medical ethics at West Virginia University. I've taken care of many patients with COVID-19 infection. Sometimes people ask me if the benefits of COVID-19 vaccination outweigh any risks of the vaccine. This is the primary question that leading public health and medical experts thoroughly examine as they consider authorizing and using new vaccines. In fact, the FDA only authorizes or approves vaccines that have undergone intensive clinical trials and were found to be safe and effective. This is certainly true for the COVID-19 vaccines, where the benefits such as significant protection against severe disease and death far outweigh the risks of vaccination, which can include minimal short-term side effects and serious but very rare side effects for a small number of people. The risks of vaccination are smaller than the risk of COVID-19 infection itself. The vaccines have proven themselves to be highly effective in preventing severe illness, hospitalization, and death from COVID-19. They are also demonstrating effectiveness against new variants. The COVID-19 vaccines play an important role in protecting you and those around you, including our most vulnerable and those who cannot yet be vaccinated, such as young children. Because there are substantial benefits of the COVID-19 vaccination, I got vaccinated and recommend COVID-19 vaccination to my patients. Thanks for tuning in. I'm Dr. Allison Lastinger. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Hi, I'm Dr. Rebecca Reese. I'm a physician and infectious disease expert in West Virginia. Throughout the pandemic, I have cared for many patients with COVID-19 and have led research on COVID-19. We are hearing a lot about COVID-19 variants, and naturally there are questions about what they are and if the vaccines are effective at protecting against them. Viruses constantly change through mutation, creating new variants or strains over time. Sometimes new variants emerge and disappear, other times new variants emerge and stay. Multiple variants of the virus that causes COVID-19 have been found in the United States and around the world during this pandemic. These variants are slightly different from the past strains, and they can even infect people who had COVID-19 before. Scientists continue to study these variants. For example, they are looking to see how easily they spread, the severity of the disease they cause, and how well the vaccines work against them. Ongoing studies have found that the COVID-19 vaccines can help prevent severe disease, hospitalization, and death from the variants. Areas with low vaccination rates are more vulnerable to the virus transforming, potentially becoming more contagious and severe. Large portions of our communities getting vaccinated helps create a firewall against the virus, preventing the virus from spreading and changing. The faster we get vaccinated, the faster we can build a community of immunity against the virus and its variants. Protecting our community from variants is one of the reasons that I chose to get the COVID-19 vaccine and why I recommend it to others. Thanks for tuning in. I'm Dr. Rebecca Reese. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Hi, I am Dr. Marina Galvez Peralta. I am a pharmacist and a pharmaceutical scientist in West Virginia. I graduated from my PharmD in 1999 and my PhD in 2004. I have been in WVU since 2015. Sometimes people ask me how COVID-19 vaccines have been developed so quickly. The COVID-19 vaccine development process has been the most efficient we have seen to date because the entire medical, scientific, and public health communities mobilized like never before to end this pandemic. Although COVID-19 was a new coronavirus, vaccine scientists did not need to start from scratch. These scientists built on a body of knowledge from extensive research of other viruses and the technology used to respond to them. Typically, when vaccines are developed, the development steps occur one after the other, from early vaccine creation to testing its safety and efficacy in clinical trials, to producing it on a larger scale, and eventually to getting it to the public. This process normally takes years to decades for a vaccine to make it from the first steps of development to use it in our healthcare facilities. In response to the COVID-19 pandemic, all these steps were taken simultaneously, removing delays that could normally happen when they are carried out one after the other. Steps to ensure safety were rigorously upheld as the COVID-19 vaccines were developed. The clinical trials, which include tens of thousands of people, showed that COVID-19 vaccination caused no serious side effects and was highly effective in preventing severe disease and death from COVID-19. Millions of people in the US and all around the world.
Hello everyone, it's August 23rd, and regretfully I've got to read to you that we've lost 8 more people. The 3,009th death in West Virginia is a 49-year-old female from Wayne County. The 3,010th death in West Virginia is a 67-year-old female from Putnam County. The 3,011th death is a 68-year-old male from Upshur County. The 3,012th death is a 70-year-old male from Raleigh County. The 3,013th death is a 53-year-old male from Preston County. The 3,014th death is an 88-year-old male from Lincoln County. The 3,015th death is an 84-year-old female from Logan County. And the 3,016th death in West Virginia is a 62-year-old female from Logan County. Go hold it. I lost my mic here, guys. Could y'all hear me, or you good? Okay. Are we sure? Because I want to be completely respectful. These are great West Virginians. They need your prayers, especially their family and all their families and all their loved ones. Now I want you to pay really close attention to these numbers. We've had 2,486 positive cases that have come in, new positive cases since our last update on last Friday. The daily positivity rate is 11.44%. Remember, the right number is 1-point-something%. Our cumulative is now at 5.06. You know, our active cases are now over 10,000. 10,543 active cases. We have 447 people that are hospitalized, 143 people in the ICU units. And I want you to pay real close attention to the map. We now have no red counties, no green counties in the state of West Virginia. Ooh, I sound like a broken record, but I can, I want to remind you again, especially if you're 65 and older and you have any health condition whatsoever that's unusual, please go get a test. The antibodies are still there, and they can save your life. We lost a trooper over the weekend. Sergeant John Siner, and 52 years old. He was killed in an accident, I think, at his home, and Kathy and I send our deepest condolences. Sergeant Siner was one of our local heroes again. And it is tragic beyond belief when we lose anyone, but especially when we lose somebody that's given this much. Please, please remember him and his family in your prayers. I'm going to give you a few stats now about what's going on in West Virginia, but West Virginia is seeing a 26% increase in positive cases of people that are fully vaccinated over the last 8 weeks. We'll read that one more time. West Virginia is seeing a 26% increase in positive cases in people that are fully vaccinated, and a 21% increase in breakthrough cases requiring hospitalization for people that are fully vaccinated. We have also seen a 25% increase in deaths of people that are fully vaccinated over the last 8 weeks. Now, that's not a 25% increase of the total numbers or whatever. It is a 25% increase of deaths of people that are fully vaccinated over the last 8 weeks. We really do need to continue to stay on our toes in every way. West Virginians in long-term care facilities and healthcare settings were some of the first people in the nation to be vaccinated. We led the nation in getting out our vaccines, did we not? Now, the CDC and the federal government says we need to wait until September the 10th or September the 20th, I can't recall exactly the date, in order for people to start getting their booster shots. Now, we've still got to wait because there's some measures that we thought we could get passed and start giving those booster shots right now. Our people are working upon my direction to try to find a way that we in West Virginia can move right now. if you look at the country of Israel, Israel had an incredible absolute bump up. And I don't know if, I do have some notes. You know, Israel in the last 2 months saw cases go from 200 to 50,000. You know, there is so many indicators that say we need to move. We need to move right now, especially with the approval of Pfizer. We need to move. And we can't get past the legalities of Washington to be able to move right this second. I'm trying with all in me. We need to be giving people booster shots that are not 8 months out, but we need to be giving people booster shots that are 6 or even the possibility of 4 months out that are age 60 and older. We need to be doing that right now. I can't get the full go-ahead to go. But we are going to continue to work it night and day to try to find a way. I thought we had that. I thought we had that an hour ago. But now it's come to our attention that the pharmacies or whatever have an agreement that we, you know, with the federal government on certain things and everything, that we've got to get through more legalities to be able to pull the trigger and say, let's go. But when we're ready to go, if you're 60 and older and you are 6 months out from your vaccinations, please be ready to go, because we'll be ready from the standpoint of the National Guard and our network to be able to get shots in arms. But absolutely, we need to move forward with this, and we're trying with all in us to get through the legal, you know, hoops, and it's right now, I'm ready to go. I am ready as ready can be, and we need to get through the hoops, and we're trying every way. General Hoyer and Dr. Marsh are leading the charge, and absolutely, you know, I was informed an hour ago that it looked like we could go, and we were going into briefing, and now there's something else that's come up, and so we still got to pull back the reins just a little bit and make sure that we have the proper approvals before we can go. I urge you, if you're 65 and older and you're in a crowd of people and you have any health issues, to wear your mask and everything. It's not a bad thing. You know, we're still trying to pass on as much local control as we possibly can, but it's surely not the worst thing in the world to consider, if you're compromised in any way, to think really hard about wearing your mask. We gave out 6,500 doses since last Friday. That's really good. Our 60 and older, I'm 65 and older, are at 90.7% now. Our 50 and olders are at 84.1. We're at 70.7 of all of our population, 12 and older, all the eligibles. From a standpoint of who's eligible, it's 12 and older. I've told you that over and over. I've told you as far as your natural immunity, if you had this, it's not enough. It's not enough to protect you. It does not protect you nearly like the vaccines do. I've urged all of our young people over and over and over to please go get vaccinated. And I ask our parents and grandparents to help me get them across the finish line and get them vaccinated. I saw a thing, you know, it came across the news really fast, that there is now even more of a significant part of the populations and from age 0 to 17 is what came across. That you know, I just got a glimpse of it and everything, but I think it said that from 0 to 17, I'm sure it was probably pertaining to a certain state, but we're up in the 20 percentile, 28 percentile, whatever, of folks from 0 to 17 that are ones that are getting this of that state's population. All your COVID information is up there. We have 24 outbreaks in our long-term care facilities. We have 10 outbreaks in 10 counties on the churches. That's Barber, Cabell, Doddridge, Fayette, Kanawha, Mason, Putnam, Raleigh, Taylor, and Wayne counties. We have 40 inmates that have this now. 33 staff, members have it. I urge you about giving blood. I've said it over and over. Take advantage of our free testing. We thank Frith. We thank, Walgreens over and over. We're going to have our second round. Registration is open right now for the second round of the Do It for Baby Dog, prize giveaways or sweepstakes, whatever you want to call it. And we'll continue to push the importance of getting your vaccination to our younger people. We've tailored this toward our younger people. We're going to give away, really, over 10 weeks, we're going to give away, and it's 6 weeks, isn't it, Jordan? It's 6 weeks, I'm sorry. We're going to give away 30 more full scholarships to your choice of whatever institution you want it to be in West Virginia. We're going to give away a real nice luxury sports car. We're going to give away ATVs and a custom fishing boat, for every week. We're going to give away a dream wedding. It's a $150,000 dream wedding to a wonderful young girl, or an older girl, at every week. We're going to give away 10 years of free gas to 2 people in West Virginia every week, and whole bunch of season football tickets or all sporting events, rather, football, basketball, all sporting events, to WVU, Marshall games and everything. And we're going to give away some lift tickets to all of our different ski resorts all across our state. And but we need to get you registered. If you were registered before, that doesn't count. You got to register again. And so we'll be having our first drawing on Tuesday, August 31st, and the only thing I think I'm changing is that correct? That we'll be we'll be awarding the folks on Thursday instead of Tuesday, and so that's the only change that we had, and really that's all I've got right now. So please keep these folks in your prayers, and button up, West Virginia, buckle down, and just get a little tougher right now, and we'll get through this.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor has said, much is changing in our state and also nationally. When we look back at the first week of July as a comparison to where we are today, we have seen a 10-fold increase in the number of active cases, a 10-fold increase in the number of people in the hospital with COVID-19 or suspected to have COVID-19, a 10-fold increase in the number of people in the ICUs, and a 10-fold increase of the number of West Virginians that are needing a breathing machine or a mechanical ventilator. We see this happening all across our state, and as the governor said, and on the DHHR website, our state map is now basically getting red. And as we look at the spread of this most highly infectious disease, as the governor said, we are constantly on the lookout to find out what's happened in other places. And the governor did point out that Israel, which was touted in many ways as the model for vaccination and the model for how to control COVID-19 in the world, has now seen their rates become one of the highest in the world for new cases. And what they found out was, as they followed their people who had been vaccinated early in the pandemic, and remember, just like we were the first to immunize our nursing home population, and among the first, if not the first, to immunize our elders, as we really targeted those people over 70 years old and then over 50 years old. And we knew early in the pandemic that 77.5% of our deaths at that time were from people over 70, and 97% of deaths at that time were from people over 50. So we really targeted those populations, which means that they have had the longest time since they've gotten their second vaccine. And what Israel found as they were looking at their own population is, and this is in agreement with Pfizer, which is really the company they've partnered with. So virtually everybody in Israel has been immunized, who has has gotten their immunization, has been immunized with Pfizer, and about 60% or so of their population had been fully immunized. Their older population had been immunized at a very high rate. And what they found was, as they started to look, that the longer it had been since people had gotten their vaccine, and they looked at 6 months or greater from the second dose, and the older the population was, the more that the vaccines had lost some of their potency. And just to get reinfected, that had been right after the initial vaccine doses within the first 2 months, about 92% protection. And recently they found that that slipped down to about 16% protection. That's not going to the hospital or the ICU, but that's just getting another infection. And then what they found is in the next 2 weeks or so after that, they started to see those vaccine breakthroughs in that older population that had other medical illnesses. They saw them get sick. And as they tracked more severe illness in Israel, as their cases had gone up, what they found was that people that were over 60 years old that had been vaccinated at the beginning of the pandemic accounted for over 50% of those severe hospitalizations and people that were severely ill. And so they decided then to start their booster campaign. And over the last several weeks, really since the end of July, they have administered about 1 million third boost doses. These are not to people that are immunocompromised because of a medicine or immunocompromised because of a transplant, but these people are clearly immunocompromised as well. And what they found was by administering the vaccines to these really highly vulnerable people, looking at that first group that got vaccinated who are over 60, which is about 150,000 people when they looked at it, they saw a remarkable protection against getting not only reinfected at all, but also getting reinfected and getting sick. And so that's really the impetus that the governor communicated for us, because we have, the country's perhaps most, vulnerable population, third oldest population. And we were very intentional about immunizing many of these people very early in the pandemic. So as we are working with our federal agencies and have talked to the CDC and talked to some of the vaccine manufacturers and are, waiting to talk to the FDA representatives, we feel like it's very, very important for us to push with all of our strength to try to bring these vaccines to the people that are the most highly vulnerable. And although we're still not seeing, a huge number of people dying, of course, anybody dying is one too many people dying. But over the last couple of weeks, we have seen about a doubling of the number of people that are dying, going from about 6 per week now to about 11 to 13. And we saw just now that there was 8 people since the last update. So we are very worried. We are starting to see this inflection point again, a 10 times increase in number of cases since the first week of July. And we know that the time is now to be able to give any protective or life-saving measures that we can possibly do to our residents, particularly those older people that are farthest from their vaccine, because ultimately, if we wait too long, then we're going to be underwater like many other places are, including the country of Israel. And what they have found is the way to reduce that surge is to be aggressive and vaccinate. And they are looking at 5 months after the final vaccine, and they started with over 60-year-old people. Then they moved to over 50-year-old people, and now they're moving to over 40-year-old people, which also includes pregnant women, healthcare workers, and a few others. So we continue to work in our best way to make sure that we are following the appropriate safety precautions for all things that we do. But we also know that one of the reasons why we've done well so far is because we've been willing to push the envelope, perhaps where some others won't. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. It was a positive weekend for vaccines with 11,280. That is up from last week's number. We are still moving in the positive trend towards 91% of over 65 and towards 85% of the over 50, but we have more work to do with our other age categories. And I just want to reinforce and highlight this weekend, we worked with and understood about a family, mother and father, both in their mid-30s in the hospital, mother on a ventilator, 3 children at home, and the youngest child had a birthday over the weekend. And in our 30 to 39 age range, we're still at only 58% at first doses. This is not just about our individual choice. This is about our ability to take a vaccine that protects us and our entire family and our future. We need to think long and hard, West Virginia. We've got to get more people vaccinated. As the governor pointed out, we are working with him and we are pressing at his direction to do everything we can also on those third doses that we know we need for our most vulnerable population. We'll continue to work and do our best to get to that point as quickly as possible within the constraints that we face. Thank you.
Thank you, sir. Secretary Bill Crouch for the DHHR and Dr. Ayn Amjad, our state health officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Thank you for taking my question. I guess the obvious thing in the room is, Governor, if you want to move forward with booster shots for the COVID vaccine, and you have holdups with some pharmacies that may have federal entanglements or some type of restrictions that they're waiting for the green light, can you not authorize the National Guard to go to different county health departments or other avenues which wouldn't have those same entanglements and get the thing started, and then bring along the pharmaceutical companies when they're ready and legally able to do so? It seems like the state would have some control of this. If we've got vaccines sitting in cabinets somewhere, give them to General Hoyer's guys and send them out and start getting shots in arms. I guess I don't understand the complication of regulation surrounding it, or maybe if somebody could explain it to me, I would appreciate it. Thank you.
Well, Kenny, you know me well enough to know just where I stand. I stand just in this position. I'm ready to go. I'm ready to go wholeheartedly. From what I understand, the pharmacies, the state, everybody signed this agreement with the CDC. We just really and truly have found out more details about that, and they've just come out in the last little bit of time. I want to read you this just a second. This is my notes. This is what I was going to say. Today I am announcing that we are going to immediately begin administering these doses. This was my notes. Absolutely, I'm ready to go. Now, you know, if there's an agreement in place and everything that we're researching any way and every way that we can get past that, and we're doing that right as we speak. But Kenny, absolutely, for me to be able to explain to you why, as the governor, and why we cannot move forward to get all this done is, you know, from what I understand, of all things, the vaccines belong to the federal government, you know. But as your governor and everything, I think that our people should be getting their booster shots now, right now, and everything. And I'm going to try every way in the world to be able to achieve just that. Now, Kenny, for me to be able to explain to you why we can't get it done, listen, I can't do that, brother. I can't do that, because absolutely I'm pushing in every way to get it done. And so we're going to continue to do just that. We need to be getting shots in people's arms. That's all there is to it.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I know you've previously said that you are against mandating vaccines for state workers. I was wondering if the full authorization of the Pfizer vaccine by the FDA this morning, if that changes your thinking on that in any way. Now, this is no longer, you know, the temporary authorization, it's the full thing. Does that change your position on that in any way? Thank you.
No, Charles. I mean, it may, in somebody's mind, from a technical standpoint, give them some assurance or whatever, or maybe makes them feel better about going on and getting vaccinated and everything. From my standpoint, as far as the mandates, I want us to stay away from that if we possibly can. But Charles, you know, and I know too, that every single day we're evaluating. Every day, everything's got to be on the table. I am trying with all in me to stay away from mandates and everything. And absolutely, I believe it should be people's choice, but without question, everybody's telling you to go get vaccinated. I watched President Trump the other night. He said, listen, go get a shot in your arm. Go get a shot in your arm. You know, absolutely all of us are telling people to go get vaccinated. As far as mandating people to do stuff, I wish to goodness, and I hope and pray we're not going to get there, but I am telling you right now, everything is absolutely on the table, and first and foremost, I'm going to look after the safety of our people.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good morning, Governor and staff. And let me follow up to his question, because I asked this Friday, and you said it was going to be widely discussed amongst your staff over the weekend, whether you could do a tiering system whereby, let's say, orange and red counties would have a mask mandate in place, but if you were yellow or green, you wouldn't. But here we are today. There are 4 counties that are yellow. There are 5 counties yellow, 3 counties gold. The rest of the map is a sea of red and orange, not one green county in the state. Did you have these discussions over the weekend about tiering the mask mandate if there was to be one, and what are we looking at here?
Mark, I've had discussions. Lots of our folks are having discussions nonstop in regard to this. It was a good idea and everything, but and Mark, I would tell everyone out there, we're one step closer. You know, I mean, really, if we continue on this pathway and everything, you and I both know we're on a pathway to have masks. We're on a pathway to end up with virtual school in a lot of situations. We're on a pathway to a lot more people dying. If this thing continues to escalate and every single one of those things is still on the table. And Mark, we're working it, and we're working it night and day. Right now, I don't think we've got to jump right this second, but this can change very, very quickly, and lots of folks, are out there working it nonstop, me included. So we're trying to keep people together. We're trying to give people all their flexibility of their rights, but really and truly, first and foremost, we need to look after our kids as best we possibly can. And it may very well be that we've got to move that way and move that way very quickly. We're watching it, Mark. We're watching it real close.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, I know you don't want to make a mask mandate yet, but I also heard you say that you'd like to give boosters like today, if maybe as early as 4 months after your first vaccination. I'd like to get a medical perspective on that. If you have been vaccinated more than 4 or 6 months ago, should you be wearing a mask right now in order to protect yourself? Thank you.
I think, I've got to defer to probably Dr. Marsh in regard to that. The only thing I would add to that, Paul, is just this. With this Delta variant, everybody has said over and over that the amount, and I'm not a doctor, so I'm going to get it messed up a little bit on this, but the amount of the volume of the virus that we expel if you have the Delta variant is 1,000 to 1,400 times as much as with the COVID situation. And the effectiveness of the mask is effective, but it's not, there's still so much of it that it is not the end-all, do-all. And so,
that is the hesitancy with me on the mask. You know, from the standpoint of the vaccine, we know now that we're getting a lot of folks that have been completely vaccinated. You know, 2 of the troopers that are on my detail, 2 of the troopers fully vaccinated now have COVID. You know, now, but Paul, I think Dr. Marsh can better explain, but there's no question, in my opinion, we need to be given boosters. There is some still question, in my opinion, about these masks and you know, how crazy people are about the mask. I mean, it's you know, it's like a hysteria in a lot of ways, but nevertheless, Dr. Marsh.
Thank you, Governor, and thank you, Paul. So the data that Israel has looked at has led them to offer a booster shot initially to all Israeli citizens over 60 years old that had finished their second dose 5 months before or longer. And then they moved that to the over 50-year-old population and then the over 40-year-old population and included a few others. Pfizer as a company has suggested that after about 6 months, there is a substantial potency drop, and it happens all along, but it seems to have a steeper drop, and that's particularly relevant, as the governor just communicated, with the Delta variant. So one of the issues with all these vaccines, and we've talked about this before, but if you think about vaccines and any other mitigation measures like mask or physical distancing or whatever, all these things increase our threshold to resist becoming infected. The more the dose of the infectious agent, COVID-19 in this setting, and particularly the Delta variant, which, as the governor said, can exist in the airways in 1,000 to more times the amount of COVID virus that exists in the airways with the original virus from Wuhan, China, that is called the Washington variant. But this Delta variant is massively more infectious. And what the data around masks show is that the masks are better to prevent you from making droplets by wearing them, protecting others, about 40 to 60% better, as opposed to wearing them to protect yourself, about 20 to 30% better. And as the governor, I think, is correctly, assessing that we want to look at layered mitigation strategies. So not either or, but to have people consider all the above. And one of the reasons why we are so focused at trying to get third booster doses in many of our residents is because our oldest and most vulnerable, and the people that were dying at the highest numbers earlier in the pandemic before we had vaccines, are now well over 5 months, well over 6 months, even some of them approaching 8 months from the time that they were vaccinated. And because of that, we want to be really, really intentional about offering them that life-saving potential intervention, because the Israelis have seen, not only in that small study, 86% protection, but in larger studies, they've seen 5 to 6 times the amount of protection than the people that did not get the booster that were immunized at the same times. And the last thing I would say is that we know that you need at least a 2-month window to see a maximal production of antibodies. And there's more data now that the antibodies that are effective against the particular Delta variant is the best way that we can provide a marker, an immunologic marker, to demonstrate that we are protecting people better. And we have seen in some of our early nursing home studies that some people, about 10% of our nursing home residents that we've screened today, have no antibody. So we know that they need to be boosted up. They need more antibody, which is really the marker for protection. So we are looking at that duration, taking input from Israel, from Pfizer, but certainly, importantly, getting to these people to immunize them again, and then encouraging other layered mitigation strategies. I think it's the safest way we can go right now, as we see that Delta variant really, really starting to spread more rapidly.
All right, thank you, Paul. Next, we'll go to David Beard with the Dominion Post.
Hi, I'm going to pass along a question from a reader who wants a better understanding of the local control of mask orders. They cite an example of a public school board that requires masks for all its schools that wouldn't apply to the private schools in the same area. So they'd like to know, is there a final arbiter of local control? Could a health board or a county commission, for example, issue a countywide mask order? Or is it just building to building up to each individual business or whatever? Thanks.
David, I don't know. It's a great question, but I guess the county commission can regulate, and along with approval from the local healthcare people. But we've just really left it to the boards of education and everything. But I see what you're saying in regard to the private schools. But we'll. Let us check into that a little bit more, because, we've tried basically to address this way, that we felt like the locals, have a whole lot more insight to what's going on, in their county than maybe we have in Charleston. But we're looking at the whole process, David. We'll get back to you, on that, and we'll get back to you immediately.
All right, thank you, David. Next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. My question is about this increase in breakthrough cases of fully vaccinated people. My question is, are we collecting information or data on what vaccines that these people had received? And if so, are we learning anything about the effectiveness of one vaccine versus another versus a third? If you all have any information on that, I'd be glad to hear it.
Dr. Marsh, you've got to do this, sir.
So, as I understand it, and I will also ask if either Secretary Croucher or Commissioner Amjad want to add in, but my understanding, we are definitely tracking all of the vaccine breakthrough cases that occur in West Virginia. The CDC had decided that they would only follow those breakthrough cases that lead to hospitalization, ICU admission, or death. We are tracking all the above. I do not know at this point whether we have sorted that, though, based on what vaccine people have received. As you are inferring, Dave, we know that there is a lot of data out there with Pfizer because they worked hand in glove so closely with the country of Israel. So we have a lot of information there. There is some early data that Moderna has generated that would suggest that maybe the drop-off isn't quite as steep with Moderna, although I've also seen that the peak antibody levels are about 43 days after the second vaccine. So, and we would presume that Moderna and Pfizer would track pretty closely together. But at this point, I don't know if we've sorted that based on what the vaccine that people have taken. And Bill or Ein, I would ask you to clarify that for all of us.
Yeah, thank you, Clay. This is Bill. We've on the dashboard, you will find, if you click on the cases, we have 3,926 breakthrough cases. We do not have that broken down at this point on the dashboard by vaccine. I'm not sure. I may have more information in terms of whether we have that in hand or not. That's really a little more difficult. Do you know if that's broken down by vaccine?
David, we don't know which vaccine, if it's a Pfizer, or Moderna, or J&J right now. Right now, that kind of information is really in the patient's chart right now. We would like to collect that information because, as you indicated, that's very important to know, but we don't have that kind of detail right now, but hopefully we'll have that as next coming months, but we don't have it. Thanks.
All right, thank you, Dave. Governor, I'll turn it back to you.
Whoa, that kind of, it kind of shocked me that we're coming right back to me. There's one thing I want to address with you that just came up and everything, and I don't know, that I just found out that the Greenbrier County Board of Education decided that they didn't want me to be their boys basketball coach. And I want to address this because I know I have a bunch of questions and everything, and I want to just do it really one time and get it over with, you know. And that's just this is, you know, how do you feel? Well, to be perfectly honest, anybody would feel some level of emptiness. You know, I've coached there 26 seasons, and they've had success beyond belief. I've never cut a kid. I've absolutely never, ever had a kid become academically ineligible because I really believe in the kids, and I really, really, really stress the academics first and foremost. There's no question whatsoever this is the worst of the worst from the standpoint of the kids. I mean, that's what really this is all about in every way. You know, the principal, the assistant principal, the athletic director, they have to make a recommendation to the board, and the board absolutely has to listen to that recommendation, and they can't do things for personal preference or political preference or whatever. That's what we have state laws for and everything. Well, without question whatsoever, everyone unanimously recommended me for the job. Now, and the way that it all came down, you know, it came down with just that ugliness of personal preference or political preference. And without any question, you know, as it has been expressed in the past, you know, two individuals that I wouldn't know them if they were standing right there, you know, have expressed real live vile. And it's sad. It's truly sad. You know, from the standpoint of sad for me, well, you may say, well, how could you do it? How could you do it? Well, I want you to all understand one thing loud and clear. I don't go on vacations, and I truly will never apologize for wanting to spend a little bit of my time in trying to help kids, because I've done it, and I've done it, and done it, and really, I love those kids. Those kids mean an awful lot to me. Not just the kids at Greenbrier East High School, but kids anywhere and everywhere in this state. There's no way under any circumstance that 1 ounce of my duties as your governor would ever be shirked in any way. No way. No possibility. You know, we have many, many challenges in our state, and I would always challenge you. Find one thing that I've really missed. Find something that I've missed as your governor. I take this responsibility first and foremost in my life, period, other than my family. I will always do what is right there. Frankly, you know, the Board of Education in Greenbrier County made a decision that will ultimately hurt not me, but the kids. And from the standpoint of where we move forward and how we do things within our state, these are the very reasons that our employees across our state have laws. These are the very, very reasons. There could never be a more shining example. There's no way. You know, so with all that, so you won't call me and ask me 14 questions and everything, I've tried to cover just a little bit of it and everything. There's no question the teams have been tremendously successful, you know, that I've been able to coach there. And there's no question whatsoever about how we have absolutely insisted on academics and how much they've achieved. And I love those kids. I love them absolutely beyond good sense, because I truly believe that's the future. So as we go forward and everything, with me, you know, I hope and pray that everything will get worked out for all. But nevertheless, I just wanted to tell you that because I just got the message just a second ago, and you know, there's no question, you know, that when you do something for 26 seasons, and you have success beyond belief, and you know how the goodness that you've tried to do with everyone, every single situation that you've been in, and everything, and you know what you could still do here, you know, sure, there's a level of emptiness, but with all that, we go forward. And we keep on going north, and that's what we do. So anyway, thank you so much.
COVID-19 is still here, and the new Delta variant is stronger and more contagious than ever, and it's causing cases to rise across the country. If you're unvaccinated, you're at the greatest risk. Vaccination is the best protection from COVID.